Okay, everybody. So we will go ahead and get started. Thanks everyone for tuning into this installment of the National Fellow Online Lecture Series. This is the first lecture of the 2023-2024 academic year. So thanks everyone for being here, kicking off a new year. I'm Robby Bowers at Emory Sports Medicine in Atlanta, Georgia. I'm one of the co-chairs of the Fellows Online Education Subcommittee. James Robinson is my co-chair this year. Special thanks to Siobhan Statutos, who was my co-chair on this subcommittee last year and did a great job with me. And we're excited about where this subcommittee and lecture series is going and contributions. And so thanks again to everyone for tuning in. Everyone's feedback is always welcome regarding this lecture series and the subcommittee. So any concerns or thoughts or recommendations, please feel free to forward those along to us. So before we get started tonight, I want to plug the next lecture in the series here. That will be August 9th at 8:30. So next Wednesday, be on cardiovascular screening in athletes. Irv Fossif will be the speaker and Lee Mancini will serve as the moderator. So certainly a high yield and high level topic, especially for new fellows. And then also as we get started with football season coming up, certainly cardiovascular screening and those issues have been in the news lately with LeBron James' son for sure. Now tonight we have the pleasure of having Dr. Tiffany Bohon from the University of Missouri speaking on the role of the team physician. Before we get started with that, just a couple housekeeping issues. You've probably heard this before, but this program is to serve as an adjunct to your individual program's didactics. It's not supposed to take the place of anything. It's to provide fellows with direct access to educational experiences from a diverse group of AMSSM members. At times we'll have invited guests or international speakers as well. And overall really just help to assist in CAQ exam preparation. So for tonight, please during the lecture, turn off your microphone, turn off your video if you can. Submit any questions over the course of the talk in the chat function. Include your name and your program. That would be helpful to know where the question is coming from. I will ask the questions to Dr. Bohon at the end of her talk, and we will go through discussion from that standpoint. And then after the program, if you will, complete the evaluation. We're still working on it for this first lecture. There should be a link to it. If you view it again on the YouTube page, there should be a link there. And for subsequent lectures, we'll have the evaluation complete for you to fill out, and that'll be in the chat function moving forward. Now for tonight, again, speaking on the role of the team physician, we have Dr. Tiffany Bohon from the University of Missouri. She's an associate professor of family medicine as well as associate professor of orthopedics. Did her medical school training at University of Missouri as well as a residency in family medicine, followed by a fellowship at Hospital for Special Surgery, and now is back as one of the team physicians for the University of Missouri. So Dr. Bohon, please feel free to take it away from here. Thanks for being here.
Great. Thanks so much, Dr. Bowers. I really appreciate the opportunity, and thanks for everyone for being on here. So I will go ahead and share my screen. You all can't see my screen. Assume. Go back. Sorry for the technical difficulties. I had a great camera and everything, and then it's not working. So, all right. So you can see. Okay. So I get started. No disclosures. As I was looking over this today, I did want to disclose that I stood out at football practice for about 2.5 hours. And so before being out in the wind and the elements out at the stadium, I feel like I looked better for the talk, but you do what you got to do as a team physician. So been out at football, and 'tis this season. So objectives, what we're going to do, review the team physician qualifications, education requirements, and medical care responsibilities. And I'll go over where we can find all that on the ACSM website, but it is very helpful to go through and kind of know what we're expected to know. It's obviously a large breadth of knowledge, but good to go over just some logistics of what that looks like. Discuss the Sideline Medical Bag, review EAP, and then at the end, I will go into legal considerations for the team physician, investigating, looking into things that really opened my eyes to things. And so wanted to share just the things that I had found. not to scare us, but to just paint the picture of what we need to be aware of. So before I start, just want to give a big thanks to people who have shown me what it looks like to just serve in the role of the team physician. I've known Jim Kinnernick for a long time. He's my mentor, and I went and was his fellow. So he's my mentor and fellowship director in New York at the Hospital for Special Surgery, as Dr. Bowers said. And then also Marcy Goolsby there and Lisa Callahan, just a great picture of what it is to be first and foremost, a family physician who then goes into sports medicine and treats the whole patient and just care about each individual, no matter how good they are at sport, no matter if they're a weekend warrior or what that looks like, but just really to learn from them. I'm really grateful. And then here at the University of Missouri, my colleagues, orthopedic surgeons, the family physicians, primary care that I work with, the fellows that we've had over the years, and then our current athletic trainers. Obviously, it's a team and we all play a role, but I'm really grateful for just the people that I get to work with. And, I don't have this on here, but just the more you do this, the more you get kind of a network of people who do what you do, and reaching out to whether it's Carly Day at Purdue or Katie Edenfield, Jay Cluxton down at Florida, Kyle Smoot at Kentucky, all these people just that come alongside you and show you what it is to be a true team physician. I just see it every day, and I'm excited for you all. I think it's a great field to go into. I'm definitely biased, but I think you've chosen wisely. So excited for you all. So I will start out, this is from the Journal of Athletic Training. I just wanted to give kind of a glimpse into one consensus statement as to what they're talking about, just overarching what it looks like to be a team physician. So I'll jump to the next slide. So this first bullet point, I think, is very important to just kind of paint the picture. We've all done different coverage, whether that was me standing, in the Bronx covering a New York high school football game. I show up with the bag. I go up before the game starts. I sign saying that I'm the medical personnel there. There was no ambulance, no, EMS. I was no athletic trainer. So, from that side to now I'm looking at our stadium here at Mizzou, and there'll be multiple, there are probably, 6 or 7 physicians down there. 5 or 6 athletic trainers, EMS, ambulance. We're across the street from a level 1 trauma center. And so there's definitely just a variety going from high school to NFL, et cetera. I think taking that into consideration when we talk about what it looks like to be a team physician, because just the different things you have available are different at different places. I've worked with USA Swimming some, and traveling with them, some meets, there is an athletic trainer, some meets it's, just the physician, some it's athletic trainers and physicians. And I got to go to Maui on a trip with USA Swimming, and it was great. It really opened my eyes to doing all of it. Because sometimes you get spoiled when you have such a great team around you, but really kind of being the one medical person on a trip, being kind of the athletic trainer and the physician, really you get to see just the variety of things that you really are set up to do as a team physician, but really learn to appreciate how much your athletic trainers do, but definitely just a wide variety of different, settings that you can have. A few bullet points from this one that I like to pull out just in general, right? We, number one, should be patient-centered. And throughout this, they talked about being athlete-centered. And I think that's a great reminder of that's why we do what we do. And we need to remember that we need to have them at the center of everything. And the next few, like I said, not to scare you, but just to be upfront about the liability that we can assume. The legal responsibility for the decision to do return to play ultimately comes down to the physician, the athletic trainers, the physical therapists, et cetera. They can do a lot of kind of return to sport and give us information, but really ultimately, we have to decide, is this person ready to go or not? And also the athletic trainers' decisions, if there is a lawsuit, the physician is usually going to be involved in that as well. And so I think realizing that, when you're working with athletic trainers and you want to be trusting, but at the same point, you want to make sure that everyone is on the same page on your team. And then the next bullet, talking about the short-term and long-term risk with athletic participation. Sometimes it's easy to just worry about the here and now, but we need to worry long-term, because sometimes we do have to disqualify if they've had multiple concussions or concerns that you have, orthopedic wise, if they've had, 3 or 4 ACLs, maybe they're not going to be able to continue to play the sport of basketball. And then the last bullet here, yes, we're concerned about the health and safety of the student athlete, but also I think it was good that I think it was Ron Corson that was the first author on this, talking about protecting the institution from liability also. It's people can, there can be lawsuits against individuals and also the whole institution. And so thinking, more broadly, I think is good to do too. So I think that was a great consensus statement to kind of get things started off, just to kind of paint the picture for what that looks like. And I'm going to end with liability at the end. So I don't want to just paint, like I said, a grim picture, but I think it's good to be conscientious about this. I love what I do. I think I need to sprinkle a little of that in there, that it's there is liability, but being at football practice most days this week, since it's the first week, it's been great to be back in just in my element there. So I enjoy that. Like I said, I work some with USA Swimming. I was a swimmer here at the University of Missouri. So it's great to be able to give back in a sport that I haven't ever coached, but it's kind of that same thing, to get back in and be the physician that gets to cover for those athletes and understand kind of where they're coming from, having been there, and then knowing kind of the lingo with athletics and with swimming in particular. So definitely, I think there are for sure perks of our job, and I chose to do this, and there's nothing else I'd want to be doing in the world. So I don't want to just paint a negative picture, but say that I love what I do. And like I said, I'm grateful for all the mentors that I've had. So this is the ACSM consensus statement that I mentioned. So this is just how you get to it. Go into the ACSM website under education and resources, and you can see the team physician consensus statements, and there are multiple there. So it's very, well laid out, multiple in there, and it's across different, it's not just ACSM, it's, multiple organizations, whether it's orthopedic, primary care, et cetera. And so they've all come together to do these consensus statements. And so I'll highlight mainly one that I'll show you here. So it was a 2013 update. So I've heard rumor that there's going to be another one coming in the near future, but there was one from 2000, and then it was updated in 2013. So I'll go through some of that here. So they'll break it down into essential and desirable for both of them. So for qualifications and education, there's things that are essential, and then things that they desire but aren't necessarily essential. So want to be in good standing, have an unrestricted license, want to be kind of well-versed in on-field medical emergency care, CPR, AED use. Obviously, we, each year we learn how much more important those are. And then musculoskeletal injuries, medical conditions, and psychological issues affecting the athlete. So as I mentioned earlier, very broad, right? But that's what, as a sports medicine physician, we need to kind of just know the breadth of things, so we know, what we're seeing on the field. Desirable fellowship training. So great job to all you fellows out there doing a fellowship, and then CME and sports medicine, membership or participation in a professional association or society. So just like you're doing right now, thanks to AMSSM for all that they do in this opportunity. It's so great just to build up so many people in this great field. And then media training, I have not had that, but great that they see that as a need and recommend that for people. And the essential team physician medical care responsibilities. So once again, these are the essential ones as opposed to just desirable. So chain of command for injury and illness management. You want to know what that looks like before it happens, and you wonder, where do I need to go with this? Coordinating game day injuries. And then, like I said earlier, the final decision on that return to play. This time of year, you probably know, PPEs very well. So those pre-participation exams, very important. And I'll jump through a few here. And I think, once again, that breadth of knowledge, knowing about strength and conditioning, nutrition, ergogenic aid, substance abuse, psychological response to injury, et cetera. It keeps growing more and more, which is why it's even more important to continue to do CME and be involved in AMSSM, ACSM, et cetera. And the last one there, so documentation, record keeping, very important, something that we, probably not our number one, not why we went into what we do, but very important, just to give good care. And then also, if it's not written down, it didn't necessarily happen. And so along that litigation that I'll mention at the end too, just keeping, having good note, getting them done in a timely manner, having good, thoughtful notes showing that you did think through things, and we're looking out for the best interest of the patient or the athlete. So this is a picture of me in Colorado Springs covering a USA Swimming camp. I don't know who took this, but I was sitting there documenting. I'd probably just given a little medication, but you can see how important it is to be organized too, right? So when you're traveling and you have a minute to grab something, I love Ziplocs. And so I just have all my Ziplocs and have them labeled in the bag so I can find things and know, what I want right in that moment. So having an organized bag like I have there is important, but documentation, not my favorite, but important to do. And this is not to overwhelm, but just to show you that return to play, kind of return to sport, is not just an easy thing to do, right? This shows how important it is, what we do, that all the things that we think through with the medical factors, down to at the bottom, that fear of litigation, right? So I don't think this is something you need to memorize and know, but just to kind of, give us credit for what we do to try to figure out who's ready to return to sport. So administrative duties, once again, essential versus desirable. So you want to be aware of or involved in the development and rehearsal of an EAP, also sideline and event preparedness. And then you want to develop an agreement between the team physician and the organizing body, including reporting structure from the athletic care network. So really just communicating well, knowing who's doing what beforehand. And then desirable, overseeing the development and implementation of the EAP. Oftentimes, depending on where you are, sometimes that's the athletic trainer. And so that's where I think it's not required for us, but the essential part is we want to have our hand in that. We want to be involved in the rehearsal. We need to be there for that. And then the last one I think is great. Educate athletes, parents, guardians, administrators, coaches, and other interested parties. So I think, I feel just the other day, I was wishing I had more time to be able to educate our athletes. We're so busy doing things, treating illness, diagnosing injury, but if we can educate, we have had a lot of training to get to where we are. And so to be able to share that with the athletes, no matter if it's high school or college, we might be the only medical care that they have had for a while, or they're going to have for a while. So really using our role as a team physician to intervene and give them the best possible, just full body medical care that they can get. And this is from Dr. James Andrews. The 4 A's, and so you might have heard of this before, but availability, affability, ability, and accountability. So I think these are great and have stood the test of time with him of, someone who's done it for decades and decades. That I think all 4 of these are important qualities to have. And I think, like I said, we all choose to go into sports medicine usually because we enjoy, being around athletes and helping people get back to sport and the activity level that they want to get back to. But always good to know that it's, depending on what you do, not necessarily like a 9-to-5 job, but being available, sometimes 24/7, 365 days a year, but enjoying what you do, and then trying to have boundaries when you can, sharing the load with your colleagues. You need to be able to go on vacation. You need to be able to step away, because burnout, as we're learning now more than ever, is a real thing. So definitely being available, but having people there to help you. The Sideline Medical Bag. There's a great podcast, the Pediatric Sports Medicine podcast that Dr. Mark Halstead does. If you haven't heard about that, they're great podcasts. And there's one, I think it was last year, on the Sideline Medical Bag. So some of these are from that. And also, if you read Bruckner and Kahn, there's a good page, long page list. I think it even mentions like a portable couch or something. So I've never taken one of those, but if you read that long list, it is very just exhaustive. They have a long list of things you might want. So this is a pretty thorough list. A lot of this, when I'm traveling with Mizzou, the athletic trainer is going to have a lot of this. And so it's not necessarily me taking this, but if I'm going to travel with USA Swimming, I'm going to want a lot of these things. If I'm, covering a high school game, I'm going to want these things, or know that the athletic trainer, has a rectal thermometer if we're worried about heat illness. So I won't go through and read all these, but I think the first few are important. Obviously an AED, so knowing where that is, not necessarily in your bag, but if you don't have one in the bag, there needs to be one, ideally that you can get to and get on the chest within 2 minutes. Copy of the EAP. When I traveled with USA Swimming, it was good to have past medical history for people, so I knew who was on what medication, or who had any issues. So then if something does happen, that. Obviously, if you're covering high school, and you're just there and covering one game, you might not know who that is, but that's where, if you're fortunate enough to have an athletic trainer, hopefully they know more about the athletes and any underlying cardiac issues or things like that. But in a perfect world, having a sheet with their past medical history, having something to document on. I always like to have paper copies of the SCAT. I didn't put 5 because whether you have 5 or 6, now that the SCAT 6 is out, but having that I think is always helpful on the sidelines. I have one on my phone too, but it's just always good to have a paper copy in case you need it. So just looking through just some basic things. Obviously, can't seem to have enough gauze. O2 sat monitor is great. I used it this morning on an athlete. It's great because it gives you obviously oxygen and then heart rate, if I want to know what someone's heart rate's doing. So things since COVID, those have been a lot more prevalent. So a silver lining of COVID that we have O2 sat monitors everywhere. And then on the right there, having a mouth-to-mouth mask, if you're going to have to do CPR, a BVM would be great. But once again, if EMS is there, I'm going to trust that they have more things than I do in my bag. And then stethoscope, I always like to have my stethoscope. I can carry it with me everywhere I go, in my bag right now with me. And then today I realized that I'm old because I was calling what I thought was Coban, and none of the athletic trainers knew what I was talking about. So apparently it's called PowerFlex now, or at least here at Mizzou. But Coban, PowerFlex is great. If you have to just wrap something up really quick, it'll just kind of stick to a sweaty arm. And then braces, crutches, etc. And then, once again, athletic trainers will have hopefully the face mask removal tool, but then just, tongue depressors, alcohol swabs, skin glue, things like that. Medications, it depends, right? So, if I'm traveling with a team and I have these prescriptions, with me, or with USA Swimming, you have like a printout of things. So when you're flying, you can they know why you have those. At a high school game, you're probably not going to be giving IV fluids, right? Even the over-the-counter medicines, you want to be careful with that. Ideally you get permission, the parent knows, but you just, like I said, this list is thorough, but not necessarily things that you have to have with you at all times. And then I have a picture of an Apple Watch here because I did actually use my Apple Watch. I had an athlete once who I was covering an SEC event, and an athlete was having some tachycardia, and for some reason it dawned on me that I should put my Apple Watch on him. So I put the Apple Watch on and was able to figure out that it appeared that he was in most likely SVT. I had him, do vagal maneuvers, and then I watched it go to normal sinus rhythm, and he was able to run and, jump on the podium. And, I recommended, going to the ER to make sure everything was okay. But I knew the team physician, and so I was able to communicate with them. And so I had kind of that seamless communication, which is an important thing. Yes, all the things in the bag are important, but really communicating is something that we really, really need to focus on. So game day, what do I do? I think getting there early. You don't want to show up right before it starts. You want to make sure you know where the AED is, have everything where it needs to be, because once that clock starts and the game starts, there could be something traumatic happen right at that moment. We here in the SEC, we have a medical timeout. So 60 minutes before the game starts, we have a timeout, and I'll show you on the next slide what that looks like. But we have, all the physicians, athletic trainers for the home and away team. And then if NFL, I believe they do something with the officials also. So I think that would be a great thing too, if possible. And where do you stand in the game? I want to be able to see, but I don't want to get just tackled. And so being careful where you stand, I would try to stay behind the ball. So if the ball is moving down the field, I don't want to be where they're going to throw it to a wide receiver and then I'm going to get hit. So I kind of like to be behind the quarterback. And especially when you're traveling, you want to know where that nearest hospital is. If something does happen, they can have to get flown somewhere. Is it across the street like we have right here at Mizzou? And if you're traveling and you need to know, if someone needs some Zofran called in, what pharmacy are you going to use? What pharmacy is open? Is there a 24-hour pharmacy? So things that you want to know ideally before that moment. So this is our SEC medical timeout, which I think has been great. And once again, another silver lining of COVID. I think that now more than ever, our job is appreciated. They're seeing how important medical care can be, and how an illness can just, shut down a country. And, I think that it's been good to see the efforts that are going into really making sure that we're taking great care of our athletes. So this is why we prepare, right? So we can perform if it does hit the fan with Damar Hamlin and then Bronny James. So, USC, just another, Power 5 school that could have happened here, at Mizzou. And so I think that that really helps raise awareness that we need to be ready in that situation. And so even just a few days ago, we had our practice with all of our athletic trainers, EMS came, our fellows came. So it's really good to go through a PowerPoint of, the things that is good, our head athletic trainer went through to remind us of, and then going through and actually rehearsing it. I think we think we know what to do, but until you're down there, stabilizing the cervical spine, you don't necessarily know what to do, or you've never put on AED pads. But you really gain information when you have a multi-D collaboration like that, because even the EMS that was there, he said that, he looked at our pads and said that even if we stick the pads on and then say they come, if it's a practice and then they come and scoop them from there, that attachment is one that can still go into their defibrillator. And so I think that that's good to know that, these pads are going to be helpful not only for us, but then if they do then travel in the ambulance, that they are the same pads. So really good to have that collaboration. So venue specific, you don't want to just have one generic emergency action plan. I'll show you our map here in a second, but you want to know, where, what's the address? Where's the ambulance going to come? How are they going to get in? There's a ton of construction around here lately. What is it going to look like if, there's roads closed or gates are closed? And you want everybody to have it. So distributing it to everybody. And, here before our football games on the weekend, the athletic trainers are getting that information to the visiting athletic trainers, I believe on Wednesday before that. So some places have it uploaded to kind of a shared area where you can always have it electronic and see it, but it seems to be that's the way things are moving towards. And a little shout out to Vanderbilt. I know that I've always been impressed with them and what they have. They actually have lanyards with the EAP and location of things on that. So then when you're there and we're visiting there, we have that around our neck at all times. So we know, if something does happen, we can just look at that. Oh, and then back to the practicing. So, I sign something each year saying that we practice this annually. Okay. So my moral compass points due north. And so if I'm signing that, we're going to do it. And so definitely important to practice that and not just act like you practice it, but really important. Just like the Bills athletic training staff, right? They were ready for that situation. And so we want to be just as ready, because it's, no place is above it. It can happen anywhere. So this is what our EAP looks like. This was from last year, but you can see just the arrows, and the big thing is the address. I think they call and we know what Faroe Field is, because that's, I'm looking right at it and I know what that is. They might not know what it is. And so knowing what is the actual like street address, I think is important. So that when they do call that, dispatch knows where to send it if it's not already there, which once again, we're spoiled and we usually have one nearby most times, but always good to be thoughtful. And this, our head athletic trainer showed me when we were doing our EAP practice. I had not seen this, and so I think it was in collaboration with the University of Washington. But it's about a 15-minute video that you can kind of jump if there's different parts you want to see, but just the cervical spine, kind of mobilization and what that looks like, and different ways to do that. If you don't have a plethora of people like we do with Mizzou football, what does it look like if you can't do a 6-person lift? And so I think that would be a great thing, just to jump on YouTube and look that up if you want some more practice before you start covering high school games, college games. Just the more you can see that and kind of visualize that, the better. And I'm sure y'all have heard this, but I feel like it has to be said: by failing to prepare, you're preparing to fail. So really, really important just to assume the worst and be prepared for that worst. So Dr. Eric McCarty from Colorado came and spoke to all of us at our orthopedic graduation a couple of weeks ago, and actually probably a month ago. Was just great to have him here, and just decades of expertise and knowledge that he has. And I thought that this was just a great quick sideline exam that he does, that he has done for a long time, and have a lot of respect for him. And so I thought this was good to share with y'all. So concussion screen, obviously with the new SCAT-6, and every place does different things, whether it's C3 Logics, et cetera, different things, different places, but just making sure, what do you do for your sideline concussion screen? You do a little bit, right there by the tent or in the tent, and then taking them back to the locker room to be able to do a more detailed exam. MPCAN test, so looking for, do they have that motor strength for their brachial plexus? So MPCAN, palpating the neck, moving the neck, and then a push-up, right? Shoulder, elbow, wrist. If they can do a push-up, their shoulders, elbows, and wrists are doing pretty well. 3 hops on the affected leg for lower extremity concern, and then zigzag sprinting for cutting ability. So good, just quick things to do and know, okay, yeah, I feel comfortable letting them go back out there. And then what not to miss. So you don't want to miss a posterior dislocation of the sternoclavicular joint. Spleen, want to respect the spleen, really any internal organ, but spleen, that left upper quadrant. C-spine, heat stroke, cardiac, concussion. We assume it's concussion, but I think we need to, like I said, think worst case scenario. So maybe it is in fact a bleed, and so we want to know who needs imaging. Hopefully most people don't, but who does? And then some of those other medical emergencies, knee dislocation, compartment syndrome, and then a pneumothorax. All right, and not to get to the, like I said, kind of depressing part about litigation, but this is recently in the news, and so just showing that we do a lot of great things and enjoy our job, but we need to think too about, what does it look like when there is litigation, and am I protected? What the university hospital, what is the malpractice? How much do they cover? Because $43.5 million is a lot of money. So knowing, what is our malpractice, and what does that look like? And then here locally, Aaron O'Neill, and this was in the news, I'm not saying anything that's not already out there, but was exercising in the heat, had sickle cell, and then actually died related to that. And so everyone, now if you do anything with college athletics, we check sickle cell on every single patient, no matter what. And so with that, knowing who my athletes are, I know all the football athletes that are sickle cell, or the coaches, just so I know, it's a hot day, that if they're going to be more dehydrated, they're going to be struggling, I'm going to worry more about them than maybe someone that's not that does not have sickle cell trait. So I thought this was a great area that I highlighted. So I'll just read it to y'all. But sports medicine physicians and athletic trainers are often presented with an ethical dilemma that arises whenever an individual athlete's best medical interests conflict with the performance expectations of authority figures, coaches, parents. In almost every circumstance involving the provision of medical care, the legal responsibility for the decision to allow an injured athlete to return to sport participation ultimately belongs to a licensed physician. So flattering, but at the same time frightening, right? That it, at the end of the day, we need to make the right decision and be good with that, and if we're, in the standard of care doing the right things, then ideally we're going to be protected, but just makes us really think twice about what we're doing. We want to be really thoughtful in what we do. So I don't know if anybody was at this talk at AMSSM, but Maggie Carlisle was awesome. And I'm not just saying that because she's a Mizzou graduate, but she worked with the Detroit Lions currently, previously was with the Pac-12, and she went over some just legal considerations for sports physicians, and it was great. So I'll, steal a little bit of information from her. But really she was, saying it through the eyes of a physician, a lawyer, and a priest. And so is it practical? That's where the physician's eyes, is it, what they did, is that, something that they would kind of be straightforward and kind of what they would consider doing reasonable, a lawyer, looking at it kind of with the lawyer eye with litigation, compared to the standard of care. Is that something that someone else in my position would do in a similar community, similar team, et cetera? And then number 3, just the ethical, a priest, trying to look at it, whether it's, an eye like a priest or your mom or someone saying like, is this really the right thing? And I think when you go through each one of those, with the few cases that we had this year, it just makes me more confident in the decision that we made after you go through each one of those. And really the moral of the story, per Maggie was, just do the right thing. That's a common theme. You want to make sure you do the right thing, and it's hard. Because, in the eyes of who, are you doing the right thing? If you have an athlete saying, this is my life, this is what I want to do. If I don't play football, I won't do anything. This is what I'm born to do. And it's hard, and she mentioned Any Given Sunday, that movie. And, I think that you really want to just have that eye of, you want to do the right thing for, like we mentioned earlier, that athlete, short-term and long-term. They might not see past today, but that's our job. To really be thoughtful long-term. So the Good Samaritan laws, ideally that's going to be, protective, but really it varies state to state. And I looked through a few cases where they were, people were trying to say the care that they gave was under the Good Samaritan law. But the 2 words that really kind of stuck out were the voluntary and emergency. And so, voluntary, if someone's walking by something happens to happen, that's more voluntary than you're scheduled and signed up to cover something, or you're, wearing gear of the school that you always cover. Is that voluntary? You can argue, in my opinion, either way. And then emergency, is this something that had to be done right then? Or, did they reduce something that wasn't necessarily an emergency right then and there? And then also, if you have a duty of care, are you truly protected by the Good Samaritan laws? And, I saw cases go different ways, but AMSSM has a good kind of infographic handout on this. And so talking about ideally the protections that we would get for covering teams as a team physician, but it really depends. It's hard to know what's held up in the court of law, but I think this is a good kind of some good reading material on the Good Samaritan. All right, so potential liabilities. So what are some things? All these PPEs that we're doing, especially if you're doing mass events and you have lots of them coming through and you're just signing them, I think it's a good reminder that we need to be thoughtful. We don't want to, have some murmur pass us by. We want to ask, how many kidneys do you have? It should be on the sheet, but reading the sheet, making sure you're picking up on any abnormalities, and making sure you're getting good, accurate blood pressures. Because like I said, this might be someone's, just their one kind of touch with the medical system, and we want to really make it worth their while and catch things that we need to see. And then this was interesting to me. So I would, I don't see the refusing to let someone play as a reason to have litigation, but some people feel there's been cases of they've been kind of discriminated against because of saying that they're not able to play because of a medical issue. So not only if you wrongly let someone go play too soon, but also withholding, not letting them play also can be, have some litigation involvement with that as well. So once again, doing the right thing in that moment, what you think is best. And then return to play. And then, like I mentioned earlier, team physician and athletic trainer, right? It's, someone gave a great talk a few years ago, right when I got out of fellowship, and they were talking about, even if it's the athletic trainer that's out there managing that C-spine, if something goes wrong, who are they going to go after? They're going to probably go after the physician. So they, the amounts just go up and up. And so they want to go after the physician as well. So really, knowing and trusting and training up your athletic trainer. A lot of them have done this for a really long time and might, know way more than I do about managing a C-spine. You might have some new athletic trainers. There's a lot of turnover, I feel like, just the last few years in the world of athletic training. And so, having in-services where they help teach you, or vice versa, you help teach them. I think it's great to just make sure that everybody's on the same page. And then privacy, right? And I think that in the medical world, as physicians, we are very good at this, right? We know and respect HIPAA. And so, other areas, they might think it's fine to just flippantly talk about someone's medical information or mental health concerns. And we really just have to hold those cards really close because it is not our information to tell. And like I said, I think that physicians in general do a really, really good job of that. So professionalism, once again, you ideally aren't going to be where you are without being professional, right? So to get through into med school, into residency, into fellowship, like you have had, good marks in professionalism. But I think that's something that, this talk can go a lot of different ways. But I think if we are, practice good professionalism and do the right thing, that's kind of my whole talk in a nutshell. And so I thought this was a good quote in here. So honesty, integrity, reliability, responsibility, respect for others, self-regulation, and above all, doing what is best for the patient despite outside pressure. So I think that just kind of sums a lot of this up, right? So it's a really good quote. And then in this article, they also talk about, not becoming just a fan, right? We're not there to watch the game, as a fan. We're there in a medical role, right? It's my job. I'm there to watch and see things that maybe somebody else doesn't see. And just to be careful, in the world we live in, it's so easy to just, to get prideful about things in the role that we are, but really knowing that can cloud your judgment, right? You want to do the best thing for the athlete. And if you, really want the team to win and you love this team so much, you might want to err on the side of keeping them in when you know that they really should come out. So really doing the right thing, really important. So my athletic trainer sent me this picture of myself. We were, I think, at K-State last year for that game. And you can tell I'm more serious than I usually am, but just really, really focused in that picture. So this was great. A couple of AMSSM and Dr. Kodehi and Dr. Young, just to, once again, do the right thing, right? So whether they're a weekend warrior general population or, they're elite athletes, in the NBA, in the NFL, et cetera, really knowing at the end of the day, we want to do the same thing, do the right thing. So good reminders. You want to make sure you're, check into the liability and make sure you have insurance covering, doing what you're doing, risk versus benefit, right? I talk about that all day long, with all my patients about different things. And same thing is true here, right? If someone's going to go on and they're going to play in NFL and that's going to be, their career, are they going to want to, try to do more and pursue that more versus, they have 2 more weeks and then they're done, right? So just figuring out kind of like that return to play, that big kind of algorithm I showed you, you want all these things to kind of play in, but at the end of the day, kind of doing the right thing and, short-term, long-term, like I mentioned. So we are here at the review questions. So Andy, I don't know if you want to jump in. There we go. Can you all see the question behind the poll? Do you want me to read it?
Yeah, read it if you can.
Okay. I have it written down here. Let me read it. Okay. All right. You have accepted a sports medicine position that involves covering an NCAA Division III university. Which of the following is true in regard to the administrative duties of a team physician? A, the team physician does not have to be involved in the development and rehearsal of an emergency action plan. B, having an agreement of medical care and administrative responsibilities between the team physician and the organizing body is desirable, but not essential. C, it is essential for the team physician to be directly involved or aware of sideline and event preparedness, such as environmental concerns, supplies, and equipment. D, it is required to educate athletes, parents, administrators, and coaches in medical care. All right, good job. So 96% said C. So C is the correct answer. And that's where I tried to cue you in earlier, right? That there's essential and desirable. And so that's where, looking at that 2013 consensus statement, you know, obviously, like I said, D, I would love to educate everyone and make that, you know, essential, but, you know, it's not on the essential list, but C is correct. So great job. All right, we can go to, it's not letting me advance. Here we go. All right, so number 2. Okay, question is, which of the following is true regarding the liability of team physicians? A, team physicians providing event coverage are covered under the Good Samaritan Act if they have not established a doctor-patient relationship with the athletes. B, team physicians are not at risk for malpractice if the athletes have signed a waiver of liability and indemnity agreement. C, lawsuits have been filed against team physicians for failure to clear an athlete for participation due to a medical diagnosis. D, athletic trainers can dispense prescription medication to athletes with the physician's approval. All right, good job. So yeah, majority said C, so 77% said C. So it is C. I'll read that again. So lawsuits have been filed against team physicians for failure to clear an athlete for participation due to a medical diagnosis. So that is true. There have been some cases that people feel they're being discriminated against because of a medical illness, whereas in my opinion, what you're doing is the right thing, and that will stand up in the court of law if you're, you know, doing the right thing for the patient. So that part kind of blew my mind that that is out there, but it is. And I want to talk about B a little bit. So waivers. And so there's been some medical things that have come up in the last year or two that we have looked into having kind of legal counsel here have an athlete sign a waiver saying, you know, they're willing to take on this risk or, you know, be on this or not be on this, but legal really frowns upon that because them signing a piece of paper isn't necessarily going to stand up in the court of law. So once again, you have to do the right thing, right? We can't kind of fudge the line saying, well, if you sign this, then you can play. In the end, that's, if it's not the right thing to do, that's not going to help anybody in the end, even the athlete, right? If something bad's going to happen, it's not going to help them. So waivers continually get asked about here, and then parents will bring up, well, can't they sign something? Because everybody, they want to play their sport, right? They don't want to not play. And I get it, because there's, risk of not being involved in sports. But at the same time, our job is to do the best kind of safest thing for them medically. And so we want to make sure that we do the right thing. All right, so number 3. There we go. Okay, let me read this. All right, as a team physician for a college football team, you were asked for details about the injury of a star player. Which is the most appropriate action? A, you are employed by the college and therefore are obligated to update the staff and program administration with the details of the medical treatment you provide to any of their athletes. B, HIPAA compliance does not apply to athletes since they are public figures, so you may communicate freely with the media. C, when speaking with the media, you may discuss an athlete's healthcare data only with the specific authorization of the athlete. D, you need to obtain specific consent from the athlete to discuss any details of medical care with the athletic trainer who is caring for the athlete. All right, so the answer is C. It seems like every answer is C, right? So 58% said C, 25% said D, and then 17% said A. So with this, what they're saying for C is, if an athlete kind of gives you approval to talk about it, then you're able to. So let me look at D here. So D, a lot of people said D, you need to obtain specific consent from the athlete to discuss any details of your medical care with the athletic trainer who is caring for the athlete. So a lot of times we already they've already signed something saying that the athletic trainer is okay to know all their information, or then when they show up in the computer, they're listed as a contact. And so I'm okay talking to them. We definitely want to be careful about that, right? We don't want to just talk to anybody about their information, but kind of the athletic trainer athlete relationship, most places, if it's already been established that's okay, that's usually okay, but always good to make sure that something's being signed there, because you do not want to talk about information with anybody. We get are really careful with mental health, right? Because we don't necessarily want to share that with the coach or with anybody else. And so really being really careful and with all things, but especially mental health. But yeah, C was the answer on that. And people get fired for this, right? You hear people talking about information about patients or an athlete, and then they're let go. So, kind of like not getting in and looking up, someone's chart that you shouldn't. Same thing, we worked hard to get to where we are. You want to make sure that you're not going to the media or telling someone's, private health information that you shouldn't be. All right, so let's see. It'll let me go to 4. And get a little break in between each one. So sorry, I'm not sure why it doesn't advance.
I'm going to go ahead and launch the question.
Okay. All right, so let's get question 4. I'll get the right one here.
Okay. I'll read the complete question here.
I can do it. I just got it.
Okay.
All right. So question 4, as a team physician for your local high school, one of your transgender female athletes would like to participate in track. She transitioned over the past 6 months. Your athletic trainer consults you for determination on eligibility. What is your recommendation? A, your athlete should have a simple and cheap total testosterone serum level drawn to determine eligibility. B, the National Federation State High School Associations, NFHS, considers this to be a matter addressed on a state-by-state basis, and you must contact your state administrative body and know the rules of your state. C, you permit the athlete to participate and coordinate with their primary care physician to perform chromosomal testing. D, start your athlete on testosterone suppression since you know performance is decreased by approximately 20% within a few weeks of suppression initiation. All right, great job. So 96% said B. So correct. It is a state by state decision. So that is why B is correct. All right, so one more question and then I'll kind of have a wrap up. All right, so I will read number 5. So you are serving as a ringside physician for a boxing event in your city. Which of the following is true? A, the pre-flight or the pre-fight physical examination should be performed no more than 48 to 72 hours before the bout. B, a physician volunteering for boxing events is protected under Good Samaritan laws and does not require malpractice coverage. C, a ringside physician is not only responsible for safety of the fighter during a contest, but is also responsible for the pre and post-fight evaluations as well. D, a neurosurgeon should be present at the event. All right, good job. So 84% said C, and that's correct answer. 12% said A, and then 4% said B. And this one's kind of tricky. I feel like if you're in the boxing world, you know more kind of what this is. And so I think finding out what is required before you do something is always a good idea. And then what's covered, right? So I think the Good Samaritan law, that one, ideally, if you're volunteering, you would think that you would fall under that. But sometimes we have a duty if that's, you know, we've been trained to do these things. We're not just the Good Samaritan that happens to be strolling by. So the answer is C, you know, all those things kind of have to do with that coverage of that contest. And so C is the correct answer on that one. All right, and then we'll jump to the end. So just some take-home points, and then we'll have any questions that y'all have at all. So take-home points, be prepared, you know, organize your sideline bag. You want to know, you know, what is where. When my first travel with the team, I open up my medicine kit and I go through and organize it all, because if I all of a sudden need something fast, I want to know exactly where it is. So use Ziplocs, whatever you need to do to organize that bag. Rehearse the emergency action plan. You know, I can't stress this enough. I think this year more than ever, you know, seeing how the Bills, you know, did so well, we all want to thrive in that situation. And if you're not practicing it, you're not going to be competent. You're going to make mistakes when you're actually doing it. I'd rather make mistakes when you're just practicing it, right? So really rehearse that. Know your local laws and malpractice coverage. You know, don't just assume that everything is covered. You know, seeking legal counsel. If you have like a go-to local lawyer or someone for the institution that you know works in like risk management, there's usually someone that you can reach out to. And then just in general, you know, I think now more than ever, we're realizing, you know, you really don't want to be liable being alone with the patient, right? So you want to always have someone, if you're in a room, you know, trying to have the door cracked if you have to, or something, if there's not a person in there, especially if you're traveling, you know, with a swim team like I was, you want to make sure that you're not alone in a room with an athlete, because people don't know what's happening behind that closed doors. Even if nothing's happening, you want to have someone there to kind of be another set of eyes. Resist peer pressure, right? So the coaches, teammates, administrators, parents, agents, etc. You know, it's hard you want to in that moment maybe give in and let someone play, but deep down it's not necessarily the right thing to do. And so really, doing the right thing. I think the 4 A's, like I mentioned at the beginning, were great. I think humility is not an A, but I think we need to add that to pretty much every role we're in, right? I think being a part of a team and realizing we all bring things to the table, but I think, really being, having humility, checking your ego, really important. Communicating well, right? We have to over communicate. We want to all be on the same page. We want to communicate well with the student athlete, with the parents. If I'm, sending someone to the ER, I want to call that into the ER. I want to kind of, I don't know if you can really ever over communicate, but you really want to go that extra mile and make sure that everything is being said and there's good transition. So, and then the last thing, just, do the right thing. I think that's, if you remember anything from the talk, just, that's going to help you, if something's hitting the fan, if you did the right thing, it might be a headache going through things, but, you want to make sure that you're on the right side of things. So, all right. And then that is it. So any questions that y'all have, I'm happy to answer. I know it's probably already been an hour, but I'm happy to stay on, or my email's there. So feel free to reach out, email me, whatever.
Awesome. Thanks, Dr. Bohon. I really appreciate it. Awesome talk. So there are no questions in the chat yet. I'll give it a minute or two to see if anyone has any questions. So I'll pose one, and I think some of us, may find it a bit overwhelming to try to think about practicing the emergency action plan, especially, whether it's for your high school or what, in your opinion, what's the best way to coordinate that? I know, like for y'all at Mizzou who coordinated it, and just some tips or pointers on your thoughts as far as best coordinating practicing the emergency action plan.
That's a great question. So, here at Mizzou, it's easy because we, have everything right here. And so our athletic trainers coordinated that, because they're the ones that during like games, they're the one that communicate more with EMS. And so our athletic trainers kind of took point on that and had EMS come. And so that was the one we did. We also have what we call our Friday Night Lights program. And so all of our, residents mainly that are going to games, fellow going to game, we have kind of an in-service here where we go through all that, the spine boarding, AED, all of that. So we're not necessarily in the field. We're not necessarily like at the high school where they are, but we're rehearsing it, we're practicing it here. In a perfect world, it's on that field, it's in that gym, etc. But I think that's where, if we at least know where the AED is, and then we can extrapolate, just the act of practicing it somewhere. But, at a large institution, I think taking time to get everybody together to do that, I know in the NFL, they pay like a third party company that comes in and like they go through it and they test them. So then when it does come to that, they've already gone through it and then been, almost graded on it. So then you want to do better. So then when you're actually doing it. So nothing like that here, but not a bad idea. It's just the financial part. And that's where, like I said, some places can do that. So not every place can, but I think just physically going through it and practicing it with as many people as you can. And EMS, has always been great to come and, work with, fellows in the past and things like that. Like they want to help improve the care, for athletes and for everyone. And, they're the experts in the field. And so I think reaching out to EMS and saying, hey, we're, have a get together, have, if you're all in charge of high schools, have a night where there's like a practice for this, they go through spine boarding, go through cardiac, event, and they can actually practice doing those things just to kind of make it that much easier if they do have to do it.
Yeah, for sure. I agree wholeheartedly on practicing, and you may feel like the emergency action plan in your head, but unless you go through the reps. And so I just tell any fellows, I mean, certainly your program a lot of times should help coordinate that for you. But if you're newly out of fellowship, if you're taking care of a high school, hopefully you have an athletic trainer, which I think it's sad that I have to say, hopefully you have an athletic trainer, but it certainly is real life. And just doing your best. It may seem a little overwhelming, do your best to try to run through that emergency action plan. So I have a question from Carrie says, how do you go about getting supplies for your medical bag, like EpiPens or certain prescriptions?
Good question. So, here at Mizzou, it's easy because we can get that from a pharmacy, we prescribe it and then it goes through athletics. And that's where it gets tricky with like high school or things like that. You're not necessarily going to have that. And, that's the liability part too, right? I'm on staff here and practicing medicine in a clinic and then also traveling with the team. So it's the same, my coverage is the same. They expect me to do that for the athletes. And so if someone's just more of, like covering a high school or something, you want to make sure that that's the kind of expectation that you're supposed to have those medicines and give those medicines. And so, if you're supposed to have them, through USA Swimming, they get those in order. It's not like I'm showing up with these medicines. They've gone through the proper kind of channels, avenues to get those and let you travel with them, et cetera.
Yeah. One other comment, there are no other questions right now. One other comment I'll make, I did post in the chat if anyone's interested, just the joint, it was officially from AOSSM, but it was joint across the sports medicine organizations. It came out in June, just a joint statement about the rising liability as we get into, it's not just professional sports now. We have all the NIL stuff, and which is trickling down to collegiate athletes, and we're even seeing it in high school athletes now, where they have advisors and NIL deals, and so there's more money involved, and so from a medical liability standpoint, if something happens, I think there's a lot more at play. So it's an interesting statement, just as far as some of the risks and rising risks of being a sports medicine doc. So just something to keep in mind moving forward. So with that said, again, I don't see any other questions. Thanks a lot, Dr. Bohon, as far as joining us and for a great talk and taking the time to do it. Really appreciate it. As far as everyone attending, just keep an eye out in the weekly AMSSM email blasts and weekly updates. There should be a link coming up soon that will be within those emails that you can click on the link and provide any recommendations for speakers or topics that you would like to hear that maybe you haven't heard as part of this lecture series before. So look out for that. And thanks again for everyone for tuning in this week. And please tune in next week, August 9th, for the cardiovascular screening and athletes talk with Dr. Asif. So thanks again, everyone, and we'll see you next week.
Thank you.